Recently I was in Seattle, and as always I was talking to a cabbie. Having been a cabbie myself, it's something I do. He had lost his landscaping business in the Great Recession, and he'd started driving a cab. He bought his own insurance coverage for a couple of years, but then he had to drop it both for himself and his entire family because he just couldn't afford it. Not even the high deductible plans. Needless to say, he's one angry man who's lost faith in Democrats and Republicans. There are millions of people like him out there who are looking for new leadership. In the 40 years that I've practiced medicine, healthcare expenses have gone higher and higher, while the gains in life expectancy have gotten smaller and smaller. In those same 40 years, average real incomes for the bottom 80% have gone nowhere. And one big reason is that healthcare costs have eaten up take-home pay. Now, for the first time in a generation, life expectancy is actually going down drastically for millions of people while we spend over $3 trillion on healthcare. Simply put, the healthcare system is not delivering. In fact, the system can't deliver health because that's not what it's designed to do. In fact, our system perfectly delivers what it's designed to produce. What we've been hearing all day is the sad fact that healthcare has actually become the hidden thief of the American dream. We waste hundreds of billions of dollars on paperwork and insurance billing. We also waste hundreds of billions of dollars on tests and procedures that don't do anything for people's health, while simple, basic needs are ignored, and people are left to fend for themselves. I think one of the most important things to say is the money is there. We need that money. We could use that money to create real health. The money is there. Our healthcare institutions, from the insurance industry, the drug and device industries, to the large hospital empires, and the officials who are supposed to regulate them, they're like a runaway freight train. And it's clear that the people are not in the driver's seat. We have to face the fact that healthcare has become an inequality machine. It's lucrative for the few and an unbearable burden for more and more people. So to get the healthcare system that we need, people are actually going to have to rise up and to assert control. More and more people are ready to do just that. More and more doctors and nurses are saying enough because they're fed up with the speed up, the focus on productivity, the metrics that don't matter, and the burnout. And in communities around Boston and around the country, people are struggling with the cost of deductibles, fragmented care, the difficulties of transport, the lack of time, the assembly line atmosphere, and the loss of connection. We do need a radically redesigned system, a real system that serves all the people. To get that system marching is really not going to be enough, as Charlie just said. To win that system, we have to organize, and we have to organize across cities in America and across everywhere we can go, because we have to push for wholesale changes from top to bottom. What kind of changes? Universal coverage. Everybody in, nobody out. Massive investments in community-based primary care, a big expansion of community clinics and neighborhood health stations, training up community nurses and other health workers, a bigger focus on prevention and on structural violence. We need an expansion of opioid and substance abuse treatment facilities, And we need a whole lot more. And if we really want health, we need programs for jobs, housing, and education for the 99%. The money is there. I actually think now is an ideal time. What we have to do now is go out and organize and build a movement. If we do that, we are going to see a tidal wave of people joining us in demanding change. Mr. Trump said he wanted to drain the swamp, but it doesn't look like that's going to happen. What we have to do is build a wave, and I think it can be a massive tidal wave, and we can totally swamp the swamp. And if we do that, I know we can win. So join us, and we'll see you tomorrow for the Right Care Alliance.